All right, in this video, I'm going to talk about the pros and cons in working in acute care versus working in acute rehab. So acute care, that's going to be like OTs and PTs that are working in hospitals. Acute rehab is going to be a rehab facility. Now, acute care is going to be acute hospitals where the patients are fresh. They're just getting in the hospitals. Acute rehab is going to be the place that they discharge from the hospital to. Patients in rehab are going to be way more stable. In acute care, they are going to be less stable, and you have to be more careful monitoring their vitals and everything. All right, first off, acute care. So I got my list right here. I'm going to go ahead and read them off to you. The pro for acute care is going to be shorter treatment times, 15 minutes, 30 minutes, 45 minutes. You are there, you're in and out. You may only spend one day with the patient. You may never see them again. Acute rehab, you are going to be spending at least 2 weeks for most of these patients, and you're going to be able to see them progress. That is kind of the nice part about acute rehab is you're seeing them progress from day 1 to 2 weeks. And you're really making a difference in these people's lives. Acute rehab people sometimes will give you gift cards. Thank you for all you did. Here's a gift card to Starbucks. Next up is groups. So in acute care, you don't have groups. In acute rehab, you have groups. It's frustrating. It's annoying. And when you do groups with patients that have all different types of injuries, they may have a stroke and you're doing an upper extremity group where another patient has no legs. It's really hard to plan treatment sometimes when you have a variety of different patients. And some places are different, but for the most part, most places that I worked at, they just don't plan groups well, and they put all these patients in a group with you, and you spend all this time getting the patients, and then the groups aren't really that productive. I feel like group therapy is for the most part a waste of time, but it can be social and engaging for some of those patients, and there can be benefits for it. But for the most part, I'm not a huge fan of them, and it's very stressful for a therapist when you're managing all these patients, especially when you're on your own. All right, scheduling. So acute care, you aren't really scheduled. You get a list of your patients throughout the day. Sometimes they're on a schedule, but if you can't see that patient, you move on to the next patient. In acute rehab, you are scheduled from 8 to 9 o'clock, from 9 o'clock to 10 o'clock. You have to be on the schedule. If you leave early, this is very disappointing to the company that you're working for because they need you to see those patients for those exact minutes. And if you don't hit those exact minutes, they are losing revenue. So there's a huge push for you to be there. If you have vacation time or anything like that, they're going to be frowning upon it a little bit more than acute care because acute care, at the end of the day, the hospital gets this one lump sum of money. If you get more minutes in rehab, it's not really monetized the same way that acute rehab is. Another pro of acute care is going to be billing. So billing is, just like I said earlier, you don't have to worry about billing as much. In acute rehab or a skilled nursing facility, everything is focused on productivity. It can be like that in acute care, but not so much. It just seems like productivity is the huge push for acute rehab and skilled nursing, whereas acute care, it's like just see your patients and be done with it. Acute care is also more ethical. Acute rehab is less ethical, in my opinion, because acute rehab they are pushing for the money. They want you to see these patients. They don't even care about your documentation. I mean, they do, but the thing is, they are just like, see these patients, spend time with them. Even if you're doing things that aren't really appropriate, you might be seeing patients who are not supposed to be in acute rehab. They're supposed to be at a skilled nursing because they are unable to get out of bed. They are unable to participate. And sometimes you have to work with these patients that really should not be there, and you have to justify it while you're seeing them for therapy. And this can be incredibly frustrating. In acute care, you don't have to worry about this as much. There are ethical issues in acute care, but not as much as acute rehab. And then the last pro of acute care is going to be benefits. Benefits in general, I'm not going to say this is about every single facility, but the benefits in general in acute care are just going to be better. They are usually going to pay a little bit higher, but it just depends on the facility as well. But in my experience, it seems that acute care, because it's a hospital, they have a lot more money to just blow, and they are going to spend that money on you if you can negotiate it right. Acute rehab, they are cutting their expenses everywhere they possibly can. There's just pros and cons of each, but the benefits seem to be in the favor of acute care. Okay, what are the cons of working in a hospital or acute care? So the cons are going to be medical need. I would say there's a higher proactive need to treat these patients. You need to be checking their vitals. You need to be on top of your game. You need to make sure that you're not slouching at all. You are checking their blood pressure. You are checking their oxygen. You're checking everything that you possibly would for whatever type of patient to make sure they're stable before you even begin your treatment. In acute rehab, you can be a little bit more lazy, even though you probably shouldn't. You should still be checking their vitals. But the time in acute rehab is focused on exercise. The time in acute care is focused on making sure they're safe. Another con of acute care is going to be the medical model. In acute care, we live and breathe the medical model, and that's going to be just working with people that are not completely focused on rehab. They are more focused on the patient's vitals. They're more focused on the patient's medical stability. They could care less if you want to have the patient brush their teeth. They could care less that you're going to do OT. And most people in hospitals don't even really know what occupational therapy is. They would just say occupational therapy is ADLs. And we all know that occupational therapy is not just ADLs. So acute care can just be a little less holistic, where acute rehab, you can focus on ADLs, you can focus on IADLs, you can work on cognitive activities to help your people to improve their functional levels. In acute rehab, you could focus on low vision. You could focus on activities to improve their ability to drive after they discharge to the hospital. In acute rehab, you can actually go to their home and see their house and do a home evaluation to see if they're safe to go home. To sum it up, acute rehab is just more holistic. You're seeing the whole picture of the person's life, and you are focusing on what you need to improve to help them return to their prior level of function and to improve as much as possible. All right, what are the pros of acute rehab? There's just way more resources. I mean, you walk into acute rehab, you see all the machines, you see all the equipment. There's a lot more activities that you can do with these patients compared to acute care. Another thing that's really good about acute rehab is it keeps you sharp. It's going to keep your skills sharp. So if you're an OT and you want to work on OT things, that is the place to do it. I mean, you can work on with patients that have issues with hand therapy. You can work on splinting. There's a ton of different activities where you can just really hone on your craft on building yourself as an occupational therapist. Obviously, a pro is going to be that rehab is just more OT focused. And then the con is that it's scheduled. And then the other con is just that it's not as ethical as acute care. All right, so hopefully that helped give you a better idea of what it's like working in acute rehab versus acute care. If you have any thoughts or comments, leave them in the comments below. I will see you in the next one. Have a great day.